Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, today we're continuing our February series about the February CPC review and most asked questions, and we're up to question number 3. All right, my third most asked question is, which school should I go to? And guys, I cannot make that decision for you. There are online courses, there are college campus courses, there are facility-based courses. My first question is, what kind of student are you? Some people don't do well independently or online, and if you know that's the type of person that you are, then look for a classroom setting type of coding program. Others don't like the classroom mandatory certain time of the week or night or day class that they have to attend, and they like doing it independently. So again, as to what type of student you are will help determine which classroom setting or what type of class best fits you. I can't make that decision for you. In my personal opinion, as far as coding, I don't think it's something that you can learn online without assistance. But again, that's just my personal opinion, because there's so many little tricks, and not tricks, but notes and little intricacies of coding that you have to learn in order to code correctly. Because of those little notes and little fine things that you have to know, even with my current online medical coding program, I meet with my students several times during the week. I need to see them, even if it's online. I call it face-to-face online, but I need to see the light bulb go off. I need to know that they're understanding the material that I'm presenting to them. Now, I could just give them the material and leave them out there, but there are just so many little turns that you need to know that if I don't work with you to make sure you see them, then you're going to overlook them. I always say a trained coder's eye. You'll see things that another person might look in the code book and they won't even see those little notes, those little exclude, those little includes, those little use additional digits, those little notes that a trained eye is trained to see. So that's why I have to, even though we're online, I have to meet with my students throughout the week to talk to them, to know that they're grasping the material. Because coding can lead you to many different codes. As you're coding, it can lead you to many different codes. But you have to know what to look for so that you don't make those mistakes. So you got to decide what's best for you. Codemaster Coach can't tell you which is the best program out there or what's the best way to go, because it's going to ultimately depend on you. All right, let's answer yesterday's questions and move forward with 2 for today. All right, looking at yesterday's questions, let me show you. Okay. Yesterday's question. When coding for a patient who has had a primary malignancy of the thyroid gland that was completely excised a year ago, and there is no current treatment directed at that site, which of the following statements is true? And your options were A, when no further treatment is provided and there is no evidence of any existing malignancy, primary malignancy, code Z85.850. B, when no further treatment is provided and there is evidence of an existing metastasis, code first Z85.850 and then C32.3. C, any mention of extension, invasion, or metastasis to another site is coded to D49.1, or D, when further treatment is provided and there is evidence of an existing metastasis, code first the C78.39. Guys, the answer to that one is A. When no further treatment is provided, there is no evidence of any existing primary malignancy, then you code Z85.850. And I've got the answer down here, and it says, according to the ICD-10 CM coding guidelines, 1C2D, When the patient has completed treatment for cancer and there is not an existing malignancy, select a personal history of malignancy by site. So from the ICD-10-CM alphabetic index, look for history, main term, history. Then make sure you're under personal, not family. Go to personal. And then go to malignant neoplasm, thyroid. And then verify your code in the tabular list. All right, how did we do on that one? All right, let's look at the second question we had on yesterday. It was, what would be the appropriate way to code removal of 30 skin tags in CPT? And your choices were 11201 times 3, 11200 and 11201, 11200, 11201 times 2, or 11200 and 11201 dash 50, modifier 50, times 2. And the answer is C, 11200 and 11201 times 2. And let's look at my answer key for that. It says CPT code 11200 is reportable for the first 15 lesions, and then 11201 is an add-on code used in addition to 11200. Now remember, with add-on codes, an add-on code has to be added to the main code, which is 11200. So in order to use 11201, you have to use 11200. So code 11201 reports each additional 10 lesions or part thereof. So after reporting 11200, we have 15 skin tags remaining to report. So 11201 reports another 10 lesions, leaving 5 lesions remaining. The part thereof statement tells us that we do not have to have a full count of 10 remaining to report it. So code 11201 is reported twice. And remember, modifier 51 is not appropriate when using an add-on code. Okay, guys? If you don't understand this, pause it, read back over it, make sure it makes sense to you. But again, we're trying to capture all of those skin tags. All right, today, your question is, a patient presents with an upper arm abscess in the subcutaneous tissue. An incision and drainage technique is performed. Pus is expressed and dry gauze dressing is applied. The procedure is coded as, is it A, 10060, B, 10061, C, 23930, or D, 10180. Okay, and your second question. A 4-year-old is brought into the emergency room, crying. He cannot bend his left arm after his brother pulled it while they were roughhousing. The physician looks at the x-rays and makes a diagnosis of dislocated nursemaid elbow. The ER physician reduces the elbow successfully. The patient is able to move his arm again. The patient is referred to an orthopedist for follow-up care. What CPT and ICD-10 codes should be reported? And your choices are, and let me move this up so you can see this, 24640, modifier 54, and S53.032A, and Y9383, or is it B, 24565, modifier 54, S53.032A, and Y93.83A, or is it C, 24640, 54, S51.009A, and Y93 point, that should be a point, 83, or D, 24600, modifier 54, S53.006A, or Y93.83A. Okay. I'll see you guys back here tomorrow. Thanks. I'll see you in the next one.